Hey folks, it's great to have you here on our channel. Today, let's talk about something really important: the signs that you might be lacking in vitamin B12. And let me tell you, the 10th symptom is one of those that really messes with your routine. Vitamin B12 is super important for our bodies. It helps in DNA construction and in the production of our blood cells. The problem is, our bodies don't produce this vitamin on their own, so we need to get it from foods like eggs, chicken, meat, and also from supplements. But as we get older, it becomes harder to absorb B12. According to statistics, around 20% of people over 60 in the United States and the United Kingdom are deficient in vitamin B12. It's a serious issue that often goes unnoticed, but today, we're going to shed light on these signs that can't be ignored. Before we continue, it's important to make it clear that everything I'm going to talk about here is information based on facts, verified and reviewed by competent healthcare professionals. So let's take a look at the 10 signs of vitamin B12 deficiency that you can't afford to overlook. Tingling and numbness in the hands and feet. The first sign that may indicate a vitamin B12 deficiency is feeling tingling and numbness in the hands and feet. Vitamin B12 is crucial for our nervous system. It helps produce myelin, a substance that protects and surrounds nerves, facilitating the transmission of sensations throughout the body. Lack of this vitamin can cause issues in nerve transmission or damage the nerves, resulting in tingling sensations in the hands and feet, especially in older individuals, due to peripheral nerve damage. Fatigue. The second sign is a constant feeling of tiredness. If your body doesn't have enough vitamin B12, you'll feel tired, but it's not the usual fatigue that goes away after a good night's sleep. Even if you sleep at least 7 hours per night, you may still feel tired. It's time to check your vitamin B12 levels. Furthermore, your concentration and cognitive abilities may be affected. This occurs because your body cells don't function properly without vitamin B12, resulting in insufficient red blood cell production and consequently poor oxygen circulation. When your body doesn't have enough red blood cells to transport oxygen to tissues, you'll feel weak, tired, and confused. Studies show that taking vitamin B12 supplements can significantly increase energy levels in people deficient in this vitamin. So, if you're struggling to get out of bed in the morning, it might be time to replenish essential B-complex vitamins. Additionally, some studies suggest that specific B12 or folate deficiency can lead to a condition called megaloblastic anemia, in which the bone marrow produces abnormally large, abnormal, and immature red blood cells, impairing DNA synthesis. Megaloblastic anemia associated with vitamin B12 deficiency can also cause severe mobility problems, loss of vision, or memory loss. So, folks, don't forget to consume your vitamins. Depression. Depression is a serious issue that often doesn't receive the attention it deserves. There are various causes for this, and one of them may be a lack of vitamin B12. During pregnancy, childhood, and adolescence, B12 plays a crucial role in brain development and mental health. Therefore, if you're pregnant, it's important to take multivitamin supplements containing folate and B12. Some studies suggest that children who have a vitamin B12 deficiency in childhood are more likely to develop depression later in life. Of course, depression is a complex maze with various causes, including emotional trauma, but we can't ignore the impact of diet and emotional well-being. Are you enjoying our videos so far? Before we move on to the next symptom, don't forget to click the like button and subscribe to our channel so you don't miss out on our upcoming informative videos. Yellowish skin. The fourth sign is yellowish skin. A lack of vitamin B12 can lead to jaundice, also known as yellowing, which is a yellow or greenish pigmentation of the skin and eyes caused by increased levels of bilirubin. Bilirubin is a byproduct of the breakdown of red blood cells. With a vitamin B12 deficiency, there's a decrease in the number of healthy and fully mature red blood cells, which can lead to the development of jaundice. Typically, the skin takes on a yellowish hue, indicating the presence of this symptom. Blurred vision. The fifth sign is blurred vision. A severe lack of B12 can affect the optic nerves, causing blurred vision. You might think you need glasses, but you may actually need a B12 supplement. Therefore, it's important to check your vision and B12 levels before investing in a new pair of glasses. And don't forget to consume your vitamins. Muscle weakness. The sixth sign is feeling your muscles weak. If you notice that you're having difficulty maintaining strength in your muscles, know that just going to the gym may not solve it. Just like any part of our body, muscles need oxygen to stay firm and strong. This oxygen is carried to them by red blood cells, and to synthesize these cells, we need vitamin B12. If you're lacking it, your muscles can also become weak. So it's not just about hitting the gym. Folks, we also need vitamins to keep muscle health in check. Movement problems. The seventh sign is movement problems. Remember what we talked about regarding vitamin B12 deficiency affecting peripheral nerves? Well, that damage can affect your ability to run, walk, or even move correctly. Yes, it can happen. A lack of vitamin B12 can be so serious that it leaves your feet and limbs numb, weak, and unable to support the body's weight. Additionally, your reflexes can also be impaired. That's why it's important to listen to your mom and take your vitamins. Besides B12-rich foods like beef liver, chicken, fish, skim milk, yogurt, and cheese, also consider taking a multivitamin supplement to ensure everything's in order. Headaches. The eighth sign is headaches. Yes, a lack of vitamin B12 can be a real headache, literally and figuratively. If you're not at adequate B12 levels, some neurological side effects may appear, and headaches are one of the most common. In fact, according to research, headaches are the most common symptoms of vitamin B12 deficiency, both in adults and children. Some studies have shown that people who frequently complain of headaches are more likely to have low B12 levels. In a recent study, half of the women suffering from migraines had low B12 levels compared to participants without a history of migraines. Although more research is needed to determine if vitamin B12 treatment can improve migraine headache symptoms, we can safely say that the preliminary results are quite positive. So, goodbye headaches. Keep your vitamin B12 levels high. Irregular heartbeats. The ninth sign is feeling irregular heartbeats, also known as palpitations. This can result from a lack of B12 in the body. When vitamin B12 levels are low, a condition called megaloblastic anemia may arise, which brings with it dizziness, fatigue, loss of appetite, and heart palpitations. Palpitations occur when the heart beats unevenly. You may feel an uncomfortable sensation of strong beats and tremors, or even have a panic attack due to rapid heartbeat. The irregularity of heartbeats is directly related to anemia, which can be caused by B12 deficiency. Therefore, low levels of vitamin B12 can impair the heart muscles over time or even lead to an enlarged heart. Increase your intake of vitamin B12 and take good care of your heart. Memory loss. The 10th sign is memory loss. As mentioned earlier, the body's ability to absorb vitamin B12 decreases with age. Studies have indicated that prolonged periods of B12 deficiency can result in memory loss, disorientation, and dementia in the elderly. However, there is currently not enough evidence to support the use of B12 for those already experiencing memory problems. Therefore, it's a good idea to ensure your daily dose of vitamin B12 to prevent future issues. It's important to note that vitamin B12 deficiency is more common than other B-complex vitamin deficiencies. Absorption problems, malnutrition, oral, digestive, or autoimmune issues can trigger this deficiency. Different conditions, such as Crohn's disease, surgeries in the digestive system, or low stomach acidity, can also result in insufficient absorption of vitamin B12. Therefore, it's essential to check your B12 levels, ensure you're consuming the right foods, and lead a healthy and active life. With these precautions, you'll be fine. If you enjoyed this video, don't forget to subscribe to our channel and give us a thumbs up for more informative content like this. Thank you for watching. Your well-being is our main mission.